Hey everyone, and welcome. Okay, let's jump right in. Today's presentation is, well, it's not just a run-of-the-mill medical review. This is an absolutely crucial, literally life-saving breakdown of something we all need to have on our radar: ischemic stroke. The reality is, this can strike anyone at any time. So my goal today is to arm you with the exact knowledge you need to recognize it, understand it, and most importantly, know exactly what to do when that clock starts ticking. Here is our quick roadmap for today. We're hitting 1, the oxygen crisis; 2, two types of clots; 3, those sneaky silent risk factors. Then we'll cover how to 4, spot symptoms instantly; the absolutely vital 5, 4.5-hour window; and finally 6, prevention and control. We've got a ton of highly actionable info, so let's get to it. All right, part 1, the oxygen crisis and the brain's constant need for fuel. So I want you to think about this for a second. What actually happens when your brain is completely starved of oxygen? I mean, our brains are incredibly demanding organs, right? They need this continuous, nonstop supply of blood. That blood is basically a high-speed delivery system bringing oxygen and vital nutrients directly to your brain cells. If that supply chain just suddenly snaps, the crisis hits instantly. And that brings us to ischemic stroke. It's essentially a massive roadblock. It's a condition where a blood vessel feeding the brain gets completely blocked off, usually by a rogue blood clot or a buildup of fat. Boom, the blood stops, the oxygen stops. And without that oxygen, brain cells actually start dying within minutes, literally minutes. It's a brutal, incredibly fast chain reaction. So moving into part 2, two types of clots and how this blockage actually happens in the first place. You see, these roadblocks generally form in 2 totally distinct ways. First, you've got the local clot. This guy actually forms directly inside the brain's own blood vessels. Over time, it just builds and builds directly in the pipe until it completely shuts off the pathway. Then on the flip side, we have the traveling clot, and this one is super insidious. It usually forms somewhere else in the body, most commonly the heart. It breaks loose, hitches a ride through your bloodstream like a passenger, and travels all the way up to the brain until it gets wedged in a tiny vessel. Total disruption. Okay, part 3, the silent risk factors. Let's look at how this danger silently builds up behind the scenes. Because look, this emergency isn't usually just some random lightning strike. It is often the result of silent saboteurs. Think about high blood pressure. Uncontrolled, it's physically battering your blood vessel walls day after day. Throw in diabetes or high cholesterol. Now you're packing those damaged walls with dangerous fat deposits. Add smoking, which actively tightens up those vessels, and you're rolling out the red carpet for a clot. Oh, and atrial fibrillation, AFib, that irregular heartbeat is notorious for churning up clots right inside the heart. Mix these with, lack of exercise, age, family history, and you've got this perfect storm silently brewing. Which brings us to part 4, spot symptoms instantly. The strike. Listen up, because this is the absolute climax of our breakdown today. Every single second counts. You have to memorize the FAST acronym right now. It's a real-time, step-by-step checklist that saves lives. F is for face. Ask them to smile. Is one side of their face drooping? A is for arms. Have them raise both arms out. Does one arm just drift helplessly downward? S is for speech. Ask them to repeat a simple sentence. Are the words slurred? Are they struggling to speak at all? And T is for time. If you see any of this, dial emergency services instantly. Do not wait. Even a 1-minute delay means more brain cells are gone. And hey, while FAST catches the main signs, you also need to be urgently aware of a few other red flags. A sudden, severe, out-of-nowhere headache, or sudden blurred vision, maybe even going blind in one eye, staggering, losing your balance, or just extreme, unexplained confusion. If these hit out of the blue, treat it like the absolute emergency it is. Right, moving fast to part 5, the 4.5-hour window, the turning point. 4.5. Burn this massive number into your memory. This is the single most important metric in stroke treatment. If you can get a patient to the hospital within a 4.5-hour window from the very first symptom, doctors can actually use a highly specialized clot-busting medicine. This stuff is incredible at breaking down the roadblock and restoring blood flow, but you have to hit that specific time window to reverse the brain damage. And actually, in certain cases, doctors have a mind-blowing backup plan called a mechanical thrombectomy. Instead of just relying on the meds to dissolve the clot, they thread a tiny catheter all the way to the blockage in the brain, physically grab the clot, and pull it right out. It's amazing. But again, the faster they do this, the more brain function can be saved. Okay, let's take a collective deep breath. Part 6, Prevention and Control. Taking charge. We survived the emergency part, so let's talk about the hope and the practical steps you can take to avoid this whole nightmare in the first place. Here is your game plan to empower yourself. Keep your blood pressure and your blood sugar on a tight leash. If you smoke, quit completely. It's just non-negotiable for vascular health. Fuel your body with real, nutritious food, get moving, limit the drinks, and do not skip those regular medical checkups. Catch those silent risks before they catch you. And real quick, just a reminder that this presentation is strictly for educational purposes. Always consult your own doctor for actual medical advice. We're going to wrap up today's breakdown with a legendary medical mantra. Time is brain. It's simple, right? But it is such a provocative reminder that our brain cells are precious, fragile, and utterly dependent on that constant flow of blood. When it comes to an ischemic stroke, acting fast isn't just important. It is literally everything. The faster you act, the more of the person you save. So memorize the signs, manage your risks, because if that clock started ticking right now for someone you love, would you be ready to act fast?